Welcome to healthreform.gov. Earlier this year, the Kaiser Family Foundation came out with a new report on the cost of health insurance. It showed that over the last 10 years, health insurance premiums for the average American family have gone from under $6,000 a year to over $13,000 a year. Across the country, healthcare premiums are taking up a bigger and bigger share of family budgets, and they're forcing Americans to make tough choices between having health care coverage and going to college, between having health care coverage and retiring on time, between having health care coverage and paying their bills. For millions of Americans, rising premiums have put health insurance out of reach altogether. So they go without coverage, skipping doctor's appointments and just hoping that nobody in their family gets sick. And these problems are only getting worse. If nothing changes, healthcare premiums are expected to rise another $9,000, costing over $22,000 a year in the next 10 years. Health insurance reform will give Americans immediate relief. The Congressional Budget Office, a widely respected nonpartisan group, recently reported that under reform, Americans who work for large companies could see their premiums drop up to $200. Americans who work for small companies would save an average of $100 a year. And in the individual insurance market, for Americans who buy their own coverage and want to keep the same plan, a comparable plan could cost 20% less. That's money that's going into your pocket. As the healthcare debate enters its final phase, we're seeing a flurry of last-minute efforts to confuse and mislead the American people. But here's the truth. Reform will provide security and stability for Americans with insurance. It'll help those without insurance get affordable coverage. And for many Americans, it will lower the cost of premiums to give them immediate relief. Thank you for visiting healthreform.gov, and be sure to check back often for our latest updates.